Yo estaba pidiendo ayuda para que pudieran atenderme. Sentía que los pulmones me faltaban. Entonces yo intentaba hablar con los enfermeros, con los doctores, pero nadie me hacía caso. Después de eso no recuerdo nada. Parece ser que me desmayé. Y 2 semanas después volví a despertar y descubrí que yo estaba en coma. Debido a la falta de atención inmediata, tuvieron que meterme a un coma inducido para que pudieran hacer que mis pulmones funcionaran conectados a una máquina, básicamente.
The public health system and hospitals in general are very scarcely available for the patients in Honduras. We only have 2 national hospitals that are suited to treat many of the huge areas in the countries. There is a great need, and it's long overdue for us to be able to have a hospital that could provide all these needs for the patients.
It's just unexplainable, the need that exists in other areas of the world, like Honduras. So much suffering that it's treatable. I mean, that's the hardest part. The hardest thing is when you see people suffering and it's treatable, and you know it's treatable, and you know it's reversible. And yet, if you don't have the right resources, you know, you have to live with watching the consequences.
Here in the center of the country, people find themselves without a lot of access to acute care. There's thousands and thousands of people here who don't have easy access to high-level care.
One of the things that really breaks our heart in the clinic is to see every day people with needs that we cannot meet.
Las clínicas aquí no son suficientes. Porque no crea, hay familias que sufren.
In cases of trauma, a lot of patients come to us first, and we just don't have the x-rays to be able to take an image of a fracture. We kind of have to treat based on our physical exam and ultrasound and go from there, and then send them to the city, hoping that they'll be able to afford the cost of an x-ray.
There just is not great access to health care and basic infrastructure as well. And so that's part of the reason we had chose this location to develop the hospital project and to serve the people here.
There are a lot of clinics around, but for patients who need to be admitted to the hospital or emergency care or surgical care, there's just not enough facilities in the country for that. We're hoping with our hospital, Hospital Yojoa, that we will be able to offer those services.
Our dream is to build Hospital Yojoa here in the center of the country, where people can have a safe place to have their babies, where they have a safe place to go and have surgery, where if they're in a motorcycle accident, which is really common around here, they have a good place to go and get good trauma care.
If there is a hospital that could provide enough specialized care, also releasing some of that load for the main hospitals would be of huge benefit.
We anticipate that the hospital would serve a catchment area of around 250,000 people. And that includes over 37 outlying mountain villages that kind of funnel down towards the lake and the larger cities surrounding the area. That's part of the reason we're here. That's part of the reason we're raising funds for a hospital, is to accomplish that, to provide the highest level care that we can to the most people and do the most good that we can here.
Late last year, we bought the land for Hospital Yojoa. Right now, we're in the stage of getting ambiental licensing, so licensing with the government to be able to build. Right now, we're trying to raise support as well so that we're ready to hit the ground running when we have our license and we can start building.
So we're here on the ground. We are meeting stakeholders. We're meeting with local doctors, local politicians, patients, finding out what's going on in the area. We have a beautiful piece of land on which to build the hospital. What we need help with is funding and resources to make this dream a reality.
The need is real. We need this hospital here, and we hope that in 2-3 years we can see this hospital come into reality. And it's going to be a very happy day for us, just to see that complete, up and running.
Y ojalá que se dé ese hospital. Hay que orarle al Señor, que sea una realidad.
We love this place, and it was easiest to serve people that you love. Loving other people is to serve them, and I think that that's who we are called to be.